What's that? Good afternoon. This is the Thurston County Board of Health for December 11th, 2017. I'm Commissioner Bud Blake, Chair of the Board this year. I'd like to start off by calling the meeting to order and see if there's an approval for today's agenda.
Mr. Chair, I move to approve the BoH agenda for December 11, 2018.
Second.
It's been moved and second to approve today's agenda. All those in favor say aye.
Aye.
Aye, and that motion carries. Is there approval for the meeting minutes for 9 October and November 6, 2018?
So moved.
Second.
It's been moved and second as stated. All those in favor say aye.
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 And it carries. Okay, good. So we got a little ahead of ourselves, but it still works out. Right now, I have the opportunity for the public to address the board. And is there anybody I see in there, anybody signed up? So we have a special guest. His name is Mr. Michael Cade. He is the director, or executive director of the Economic Development Council. And we wish to give him more than 3 minutes because this man is important to our livelihood here. Go ahead, sir. You have the floor.
Thank you very much. Good afternoon. Again, for the record, my name is Michael Cade, executive director of the Thurston Economic Development Council. And I'm actually director of two organizations here in Thurston County, the Economic Development Council and the Center for Business Innovation. I wanted to take this time to really, it's more of a personal privilege and an honor to be here this afternoon to thank Commissioner Blank for his service on those two boards of directors. This is not an easy discussion for me. I have great affection for the commissioner. And I just thought if it's okay with the audience.
Mr. Cade, could we check your mic? Apparently it's not on.
We're getting signals here.
We're getting signals.
Please stand by.
It was on a roll.
Yeah, you were doing well,
Yes,
sir.
you were. I have to start all over now.
I'm not a drummer.
Do you have extra batteries for this?
Just forget it.
There's yours.
Thank you, sir.
We've been at this all day, Michael, so that's why
A lot of
batteries are dead.
hot air there.
Dead.
It's been a long day. Yes.
Need a solar-powered microphone.
But there's no sound.
I know. Should be in the same boat.
Better. Thank you.
So I won't go through that preamble again.
Just your
Just
introduction.
introduce
though.
yourself.
Yeah, Michael Cade, Executive Director of the Economic Development Council of Thurston County and the Executive Director of the Center for Business Innovation. Point of personal privilege to be here this afternoon to thank Commissioner Blank for his service on our board. It's not an easy presentation for me to make. I have great affection for the Commissioner. And I think it's important, before I just kind of go into this, I'd like to present you a plaque. I know you probably have a number of plaques in your wall, and this will hopefully make it to that spot of honor on your wall. The relationship that I have with the Board of Directors of the Economic Development Council and Center for Business Innovation is different, and you know that. Our board is a working board, but we take the direction of the Board of Directors very, very seriously. You're my boss. And when we first met, when you came on the board, I termed it that way. You are my boss. You need to tell me what to do. Mm-hmm. And you need to help me develop strategies to promote and increase economic opportunities. And so I guess it's apropos that we're here today at the Board of Health, because when we talk about the economy, the health of communities are definitely intertwined. And so I just want to take just a second to kind of talk about how we've reacted to your leadership on both those boards. You asked us to retain business and to promote markets and expand opportunities for Thurston County. In the last 2 years, we had a direct impact on our local economy of $76 million during your time on the board. We impacted over 1,500 FTE, full-time equivalent jobs. Meaning we retained those jobs. Those are family wage jobs that people use to promote their families and live and work and do things here. We launched 200 new employers in Thurston County during that time. We provided 6,000 hours of technical assistance, recruited by itself over 900 jobs in Thurston County. The Thurston County Economic Development Council Center for Business and Innovation, under your leadership, is by itself the largest economic development group in the state now. during that time. We were able to grow and expand our resources to do that. We have the highest concentration of technical assistance anywhere in Washington State for entrepreneurs. We've created an ethic and a method for growing businesses. Yesterday we launched under your leadership, we launched a new fund for entrepreneurs to take advantage of, Microlund in partnership with a community college. This is all done under your leadership, sir, and I do thank you for it. I know that this community is much better for it. I know that I professionally am better for it, and I appreciate your time and attention. I'm not the easiest executive director to work with. I get it. I understand that. I kind of a little bit of a headstrong, but I take the direction and the yoke of leadership that you provide very, very seriously and strongly. And so, with happy heart, I wanted to present to you a plaque of appreciation for your service, commitment to building and supporting, sustaining the Thurston County economy during your years of service. We had great victories. We don't celebrate those victories as much as we should, but this really is a celebration of your victory with our organization. So I want to thank you very much. Thank you, sir.
Thank you so much. Yeah, absolutely.
Yeah, you get a photo? You got it? Thank you.
Well, it's not for us, that's for you.
I know, I'm trying to get down. Bring your book. Thank you, sir. Let me say a word real quick, okay? Thank you so much for your words, your kind words there, not only from a personal standpoint, professional standpoint, and from Executive Director of the Economic Development Council and the CBNI. And I absolutely couldn't wait to get onto that board after I persuaded Kathy to let me have it. And so every day, every time I've been there, we've grown together in a lot of different ways. And it's because of, it is the board, but it's also your leadership. And so you are an excellent role model, have been for me in terms of diplomacy and strategy. And I share your passion as far as developing this county, both rural business, urban business, it doesn't matter to me. But business as a whole, I think you are absolutely outstanding at what you do. And I think you've been doing it for 12 to 13, 14 years, something like that. You are a treasure to this county, and I thank you so much for your leadership and your mentorship for me too. It's not easy to say goodbye because the economy and the things that we do to develop workforce is super important to the health of this county and to the people who live here. And so, but I just love your ties and your China ties, and so, and how you come back with each one is different, is a little thing, but really, I won't be far down the road, and whatever I can do to help out in some ways, it's been a wonderful ride, and I no matter whether it's the gopher issue or the farming issues or what have you, we work through them and together, and I appreciate you being there for the previous commission and this commission. So thank you, sir.
Thank you, sir. I
All right.
appreciate that very much. Thank you. My best
I might add that you are a doggone workhorse.
Yeah, he is, isn't he?
My gosh, you are. Thank you, Michael.
Okay, so that will move us into the department items, and we have item number 3, which is the syringe service program update. And I think Jeannie Knight from PHSS is going to give an overview, and then maybe John and Patrick can give some insight on it. Sure.
Thank you, Commissioners Blake, Hutchings, and Edwards, for giving us this opportunity today to update you about the syringe services program. With me today are John Abplanalp, our supervisor of the Investigation and Control of Disease program and our syringe services program, and syringe services program staff Patrick Judkins. They're an amazing staff that provide an incredible service to the county and the people that they touch and serve. They bring a passion to this work that inspires me to continue doing the work we do in the disease control and prevention division on a daily basis. I know we're kind of short of time, so I'm going to turn it over to John and Patrick, and they're going to talk to you about the program today. Thank you.
You bet. Thank you, Jenny. Hello, sir. How are you doing?
Hi, John Upland, Thurston County Public Health and Social Services.
There you go.
Okay. So I just wanted to start you out today with our version or vision for success with Thurston County Public Health and Social Services Syringe Services Program. And our vision of success is pretty simple in some ways, more people alive and in recovery. So short, sweet, to the point. Of course, we know that the road to recovery can be very long and complicated, and so that attaining this goal is also at times difficult. So many of us have a story to tell about when the opioid epidemic or the opioid crisis first became real for us. We may have a family member or a friend who's fighting substance abuse problem, has experienced a drug overdose, or has lost their life to drug overdose. Their opioid use may have started with prescription medications prescribed for an injury or with drug experimentation. And we've seen as overdoses and deaths linked to opioid use in Thurston County have increased, the demand for syringe service program services has increased as well, and we definitely have a lot of work to do. So just to briefly recap some of the benefits of the syringe services program, first and foremost, there have been a lot of studies that have shown that syringe service programs reduce the prevalence of HIV and hepatitis C infections in our community. The lifetime cost of treatment for one person with HIV is estimated to be over $400,000, and currently it costs about $40,000 to treat one case of hepatitis C. From a national perspective, there's definitely a return on investment for syringe services programs, and that's currently estimated to be over $7 for every dollar that's invested. And that's a pretty good return on investment. But looking beyond communicable disease, research shows us that intravenous drug users who are using syringe service programs are 5 times more likely to enter into drug treatment than those who are not using syringe service programs. So the return on investment for drug treatment is about $12 for every dollar invested, which is a great return on investment. But the key there is that we need to get folks into treatment. And that's where I see our syringe services program coming into play, and one of the most important aspects of it. And this is something that Lori and Patrick excel at. So by treating our clients with dignity and respect, they've become trusted sources of information, and they've become a lifeline to other resources that are available in our communities for a marginalized group of folks who have a lot of different needs. So Patrick and Lori are uniquely positioned to help our department and the county understand our clients' needs, as well as to get our clients connected to the services that they need to move forward into better health and into recovery. And now just a quick history of the syringe services program. These programs were authorized by the state in 1988. Our program was started by a previous health officer in Thurston County, Dr. Diana Yu, in 1993. This was started as a pilot project under her Disease Control and Prevention Authority. Her decision was based on strong evidence at that time showing that syringe service programs reduced HIV, hepatitis B, and hepatitis C infection rates, and also promoted drug treatment. The program was authorized by the County Board of Health at that time and has operated continuously since 1993. So now I'd like to turn things over to Patrick, and he'll talk to you about how the syringe service program works and talk about some of the common myths associated with syringe service programs.
Thank you so much,
Thank
John.
you.
Hello, Patrick.
Hello. Thank you. Okay, so how does the syringe services program work? We are a one-for-one exchange, meaning that people who need to get needles need to bring them into us first. We do not provide any what are known as starter kits or harm reduction kits. They need to come with us with something to exchange. If they do come in and don't have anything, we do provide them with ancillary supplies like sharps containers, cookers, cottons, and advise them where they can go to either get them for free or can purchase them from local pharmacies. We also provide education and harm reduction materials. We also promote safer sex practices and promote the increased use of condoms by people who access our services. We have a big container full of various condoms, as well as lube for our clients. We also provide naloxone training and distribution. So from August 31st of 2017 until December 4th of this year, we've distributed 1,726 naloxone kits, and we've had reported to us 244 overdoses that were reversed, so 244 people whose lives were saved. We are the first point of contact for treatment. By using motivational interviewing and trauma-informed care, we help to get people referred out to treatment and into supportive services. We help to increase awareness of treatment options, as well as provide referrals to treatment and primary health care services. We also offer safe syringe disposal of more needles than are exchanged. So far, estimated at 150,000 needles that are coming in that are actually not being exchanged. So we're just disposing of those. At our exchange site, we do not allow drug use or any dealing. And I have gone out several times to ask people to leave or ask them what they were involved with, and have them stop. That hasn't happened very often, though. We offer mobile services 1 time per week for 5 hours, primarily serving South County and East County locations. So currently in the Grand Mound area, as well as out in Yelm. And our fixed site is open twice a week for about 10 hours, so Tuesdays and Thursdays. Okay, and some of the facts and myths of syringe services programs. I'm going to go over the myths first, and then we'll go line by line with facts as well as supporting research. So some of the common myths, the main one, I'll start with the bottom, is that we enable drug use, which we do not. Another common myth is that there are more contaminated needles in the community with having a syringe services program available, that there's increased crime near needle exchange sites, increased rates of infection, and increased financial burden on taxpayers. Okay, so some of the facts. When people have access to syringe service programs, there are fewer syringes found in public areas. So supporting this was a article published in the Journal of Drug and Alcohol Dependence in 2015, a comparison of syringe disposal practices among people who inject drugs in a city with syringe services, that would be San Francisco, versus a city without, which is Miami, found about 8 times more needles on the streets of Miami than in San Francisco. Research indicates that over 90% of syringes distributed by syringe services programs are returned. In Baltimore, syringe services programs help to reduce the number of improperly discarded syringes in the community by almost 50%. And in Portland, Oregon, the number of improperly discarded syringes dropped by almost 2/3 after the implementation of a syringe services program. And according to the CDC, syringe services programs reduce needle stick injuries among first responders by providing proper disposal. And crime actually decreases in syringe service program areas because participants are connected to drug treatment, housing, food pantries, and other social services. In one study, Baltimore neighborhoods with syringe service programs experienced an 11% decrease in crime compared to those without syringe services. And those areas saw an 8% increase in criminal activity at that same time. Fact number 2, access to syringe services programs increases safer behaviors, reduces infection rates, and increases access to testing and diagnostic services. So syringe services programs do not encourage initiation of drug use or increase the frequency of drug use among current injection drug users. That was found by the Institute of Medicine Assessment back in 2016. Numerous national medical and public health organizations support syringe service programs, including the American Medical Association, American Public Health Association, National Academy of Sciences, and the American Academy of Pediatrics. So too do leading global bodies such as the World Health Organization, the World Bank, and the International Red Cross and Red Crescent Societies. The American Bar Association also strongly encourages support of syringe service programs, as does the U.S. Conference of Mayors. Access to syringe services spares lives and saves taxpayer money. As John had mentioned earlier, the Institute of Medicine has concluded that the cost effectiveness of needle exchange is estimated to range from $3,000 to $50,000 per HIV infection prevented, and the cost of a sterile syringe can be as little as 7 cents. People who use syringe services programs are 75% less likely to contract HIV than those who do not use a syringe services program. That was in the Journal of Policy Analysis and Management. Prevention saves money. So syringe services programs save healthcare dollars by preventing infections. The estimated lifetime cost of treating one person with HIV is more than $400,000. And the lifetime cost, that repeats this off here. And the return on investment for $758 for every dollar spent. And that's from AIDS and Behavior from 2014. So we also help to increase access to treatment and education. People who access syringe services programs are up to 5 times more likely to enter drug treatment than those who do not use a syringe services program. And decades of scientific evidence have concluded that syringe services programs do not cause any increase in drug use. Many studies have demonstrated that we decrease drug use by connecting otherwise marginalized people to treatment. And publicly funded opioid treatment admissions in Thurston County are up 193.5% for the 2013 to 2015 period over the 2002 to 2004 period. That information is provided by the Division of Behavioral Health and Recovery through DSHS. So what we offer is harm reduction. Harm reduction recognizes that every life is valuable and that substance use and addiction are complex and challenging. People who struggle with addiction need to be supported and not judged. Shamed people are less likely to seek substance use treatment, medical or mental or emotional help. Shaming and stigma around drug use can actually cause more deaths. So in summary, there are multiple issues to address. We need to reduce the number of overdoses that are occurring in our community. We need to increase access to substance use treatment by increasing the number of providers available and reducing barriers to treatment. We need to recognize that many of the people that we are serving are dealing with multiple co-occurring issues involving healthcare, stable housing, and stable employment. Working with them to resolve co-occurring issues supports them on their trek to on their trek toward recovery and ultimately toward hope. And we can help to move the bar for our residents, neighbors, friends, and family to a place of resilience, recovery, and hope. So we've got our contact information here. I want to thank you very much for your time.
Is that it? Yep.
Yes.
Okay, great. So any comments, Patrick or
I have 2 questions.
John or
They're
Jenny?
pretty easy, I think.
Okay.
Number 1, you said, Patrick, that it's about 7 cents a needle. What does it cost for us to dispose of the vast number of needles that we take in a year?
$1,400 a year.
$1,400 a year? That's all it costs to dispose of? Okay. And but how many needles is that then?
It was over 1 million last year.
Over 1 million. Whoa, okay. And number 2, about, in fact, November 12, just less than a month ago, Cairo News reported that there are dozens of underground heroin injection sites in King County. Assure me we don't have such a thing in Thurston County.
I have not heard of anything going on in our community here locally.
Any kind of, whether it be heroin or meth, anything else, safe injection sites?
Safe injection sites, no. I have not
Thank
heard
you.
of
That's pretty
those.
emphatic. Thank you. Okay. Thank you.
You're welcome. Thank you very much.
Thank you so much. Okay, so I'm going to move on to the next department item, which is a Thurston Thrives update. It's the monitoring community health. And I have Chris Hawkins here to give a little overview and introduce Mariana Aguara.
Good afternoon, Chair Blake and Commissioners. My name is Chris Hawkins, the Community Engagement Evidence and Partnerships Manager with the Thurston County Public Health and Social Services Department. And I just want to start off by echoing the appreciation others have been expressing today for Commissioner Blake and his dedication and leadership within Thurston Thrives, our community's health improvement initiative. Commissioner Blake stepped right in and chaired the Housing Action Team, which has been a force for community health improvement over the last several years. And he also was a founding member of the Thurston Thrives Coordinating Council, which is guiding and promoting and sustaining the initiative. So thank you very much, Commissioner Blake, for your time on that.
The funnest time is when we went out with the kids in the rain, right?
That was good too. Yeah, definitely really appreciated your participation and leadership over the last several years.
That means a lot coming from you. Thank you.
But I'm here today to introduce Marianne O'Garo, who is an epidemiologist with our health department. And she's going to talk with you a little bit about monitoring community health data. This is picking up from what you heard last month from the Thurston Thrives director, Crosby Carter, updating you on the selection by the Coordinating Council of some areas of emphasis for Thurston Thrives. And Marianne's going to talk about sort of the next step that the Thurston Thrives Coordinating Council and the initiative is doing, which is looking at some of the key health indicators that we have available and use those to better track and measure progress for the initiative.
You bet. Let's hear from Mary Ann. Hello, Mary Ann.
Hi, great to see you all. We just
Same
need to
here.
get the presentation set up and then I will start. Perfect, thank you, Chris. So as mentioned, my name is Marianne O'Garo. I work for Thurston County Public Health and Social Services. I am very lucky to work with this department, and on this topic, it's really exciting to see all the things that happen with Thurston Thrives. And today, as was mentioned, I'm going to talk to you a little bit about kind of the data picture of things that the Thurston Thrives Coordinating Council is considering to measure success and monitor progress over time in their 3 areas of emphasis. So to start with, I just thought I'd take you back for a moment because we're all in different stages in awareness of Thurston Thrives, but I was lucky enough to be a part of its founding. And I'm really glad 5 years later, plus it's still here. That actually is an achievement that is not true for every community that has taken on a community health improvement initiative like this. But one of the first tasks that I was tasked with, because this group has always been interested in data and looking at facts and information, is developing a set of data snapshots. And so the picture is just a sample of the covers of a couple of them. And at that time, there was 9 action teams. And we developed a data report for each one to kind of look at what kinds of community health data, high-level data, not service data, program data, that kind of data, but high-level community health data might be available to get a feel for what's going on around these issues that the action teams were working with. And so that was like our first dive into data. Then we took it a step further because they were interested in going further and looking at if each action team were to set some measures that they wanted to track over time, what might those look like? And we had been working on trying to describe 2 different types, community health and strategy. And so today I'm going to kind of go down the bend of showing you some community health measures. But that concept for community health measures are things that are big picture, that when you work with a collective impact project, which is what Thurston Thrives is, you're trying to create a common set of measures together that you all impact. And so underneath that are a set of assumptions. And I'm not going to go deep into this, but just to show we're pretty thoughtful about what we try to propose and what we advise from a department to others. But community health measures and the things you're going to see as examples next are really big picture things where the whole community is accountable, not just Thurston County government, not just a private nonprofit organization. Measures that inform planning, measures that identify gaps, measures that you can use to show change over time, and then there's certain qualities of those measures, like, which would be obvious. We need to have data at the county level. It needs to connect to health. It needs to be valid and reliable. some other measures along that, some other qualities along that line. So through this discussion with the action teams first, a set of community level measures of progress were developed. And I shared this with you just because you'll see some of this gets pulled off into the emphasis areas in a minute. And so this was the list that the group kind of came up with. That this fit the different action teams at the time for community health measures. And now we're at the point of the Thurston Thrives Coordinating Council, the oversight body, taking a look at what might fit and mesh with their 3 areas of emphasis. So housing stability is one, so I'm going to share with you just a couple things we asked them to consider. One comes straight out of the work of the action team of the housing action team that Commissioner Blake has worked tirelessly with over the years. And they looked at a range of things and really both in that data snapshot that we prepared way back when, 5 years ago, and then through that action team, the concept of measuring housing cost burden and that data still is something that we would encourage at least the coordinating council to consider as putting up a measure of something that they would track over time. Housing cost burden is that concept of paying 30% or more of your household income for costs that may be mortgage costs plus or rental related costs, but when you pay that much plus, it really has a negative impact on health amongst a lot of other things because you can't afford things. That could be you can't afford your child to do certain activities, and the pro-social aspects get lost for kids because their family's just trying to maintain their house. It could be keeping up with your mortgage, keeping up with things related to your house means that you have trouble paying for medication you need. There's a whole lot of reasons why housing cost burden connects to health, but this was one measure that was proposed, and then this kind of shows you the housing action team proposed looking at it for all folks, whether they're renters or owners, and then kind of breaking it down so that we can see if there's change over time in terms of what happens to owners and renters. But one of the beauties of this particular measure, though there's other things you could choose, is it does have the ability to break down further than the county level. And so this slide is just an example of if you took that concept of being housing cost burdened, we can look deeper within Thurston County. We can look at cities, for example, and the data is available. And this just shows you when you look a little deeper, for example, the city of Yelm, 42% of households there are housing cost burden. That's different than Thurston County overall. That's important to know. There might be some different needs and issues, but that's one of the benefits of this measure. We also proposed some consideration of looking at residential mobility. One of the things that's residential mobility is just that moving to a different house. And in this particular measure, it's within the past year you moved to a different house. And one of the benefits of looking at this from a community health perspective is we know that the longer someone lives in one area, the stronger and wider their social circles are, and moving can disrupt that. It also can disrupt things like who's your healthcare provider. So residential mobility, though we kind of talk about it a lot, it has some really interesting health implications, and it's a really important issue for Thurston County to consider, not just because we have military residents, because that is part of mobility, but we have people who are having to move to different locations because they can't afford their housing. So like there's a connection. A second focus area that Thurston Thrives is considering is child and family resilience. So 2 things that we suggested that they might want to consider, which was on that long list of community health measures I showed earlier, was something that seems to resonate in Thurston County is to take a look at kindergarten readiness. There's many different ways to measure that, but it is a really good point at which to measure that concept of resilience. And so this is a proposal that came out actually of the action team of something they would like to see measured at the community level. Another one in the health world, which also is whether you're in education or economics or however you're looking at different things, one really big indicator of health is high school graduation. even though we know it is not adequate necessarily for a living wage, like there's, and cost of living, different things like that, but looking at high school graduation and what you're looking at from the data on this slide is graduation requirements have changed, and there probably will be more high school students who it'll take 5 years for them to graduate. They're going to be super seniors, just because of the way some of the things change. So this is based on graduation within 5 years instead of like a traditional 4. But the reason why this can also be beneficial is for what I had mentioned before. You can look a little deeper. And like the next slide is just giving you, if you broke down high school graduation, our overall figure, and you broke it down by race, ethnicity, male, female, you can see that it's different. There are disparities. And if you're trying to improve overall health, sometimes closing the gap in these disparities can be an important focus, or at least an acknowledgement. And this is not saying that this is a school focus issue. Like, this is not just about schools. High school graduation is a big picture thing. It matters what resources they have available. It matters what resources family have available. There's a whole lot of things that go into what actually produces high school graduation, but it can be a really important health measure. A third area of emphasis was economic opportunity, which you were talking about earlier, and all the wonderful things occurring in Thurston County, and then of course the need for more. There's different ways that you can deal with economic issues in terms of data. One thing though we did propose, and there's different ways to measure this, is income is a determinant of health. That's science shows. So having that on the list could be very beneficial to keeping track of that. There's lots of things that affect what your income is, but keeping in mind possibly low income or living in poverty, what our figures are, is it changing over time? Is there differences in small kids, families with small kids, overall, older adults? It might be beneficial to track for the Thurston Thrives Coordinated Council. And then this is just another example of a different way you could look at income. So extreme poverty, really at risk for homeless. That's a different way of looking at what this measure can do for you. So what we left it at is their November meeting, kind of describing some of these options. They're going to ponder and work further. Other ideas, but help them from our department to their effort, help them in whatever way with whatever they decide to measure in any way we can. They're going to have further discussion in 2019, but I did want to share with you just really quick something that's coming forward, just so you know that this is happening. One of the things that we're doing in 2019, and it's consistent with best practice, is that every 5 years a health department should do a community health assessment. And so 2013, 2014 in essence was our last one, those data snapshots that I described before. And a community health assessment is looking at local data, looking at emerging trends, looking at a large array of health issues, and taking a look and making that data available. Plus, for public health accreditation, we have to have done a community health assessment within 5 years. So to apply, we really need to go through this process as well. And to let you know, this would take the form of a data report available to the community. We're looking at doing an equity focus, so that basically means that if we're really going to get the highest level of health for all people in Thurston County, you know, capital ALL, all people, we need to take a look at what's going on in terms of health disparities and where there might be differences, where gaps need to be closed. And so just on this slide gives you a feel for, we have a lot of data. We're really lucky in Thurston County, and we'll be breaking it down kind of like we showed you before, what we can do by race and ethnicity for graduation, other things like that. Making sure those Thurston Thrives Coordinating Council measures, if they select them in time, this next summer is when this should be done, get those in there. But this is a resource that's going to be coming available, and hopefully it's something you'll be interested in, those findings, because it should be really useful for our community. And on that note, that was my last slide. But I also wanted to thank Commissioner Blake. I really appreciate you. I appreciate being able to come to this board, and I appreciate things as simple as your willingness to put suicide on the agenda and discuss it. And then I appreciate having kind of helped start up the Housing Action Team to see how vibrant it is as a result of your work. So I just wanted, from my little data world, I just wanted to tell you how much I appreciate what you've done. So thank you.
Thank you for your professionalism too, Marianne. It's really important to me.
Yeah. And any questions? Otherwise, I'll go.
Any questions?
Nope, thank
Okay.
you for all you do.
Thank you.
No, thank you.
Thank you, Marianne. Okay, so that brings us to item number 5. And item number 5 is adopt the resolution H-3 2018 appointing an alternate local health officer for 2019. And are you going to talk about it a little bit to give us some background?
Good afternoon, Commissioners. I'm Shelley Slaughter, Administrator of the Board of Health and Director of Thurston County Public Health and Social Services. And I'm here to ask you to adopt Resolution H-3 2018 to appoint an alternate local health officer. Dr. Rachel Wood, to my right, is your appointed health officer. However, each year the Board of Health considers appointing alternate health officers in the unfortunate event that Dr. Wood would be unable to serve in her role. It is also in the fortunate event if she gets to do something like go on vacation. So we appreciate having alternate health officers. RCW 7005051 requires Thurston County to have a health officer. This proposal is for you to consider is to have any qualified health officer that meets the qualifications according to state law to be able to serve as Thurston County's health officer should Dr. Wood be unable to serve in her role. It gives Dr. Wood the authority to appoint an alternate. If Dr. Wood is unable, then myself, the chair of the board, or the county manager would be able to do that. We always look first at our regional health officers and our neighboring counties for support and backup coverage. However, in times of severe emergencies, that may not be possible, and this resolution gives us the opportunity to have any health officer in the state of Washington be able to support Thurston County.
All right. Any questions of
No,
Shelley?
I think it's a good idea.
To have a backup?
Absolutely,
To
for
have
the
a
dog's
backup.
sake, yeah, for your health.
Okay. Okay, is there a motion to adopt?
I move to adopt Resolution H-3-2018, appointing an alternate health officer who is qualified in accordance with the standards prescribed in RCW 70.05.051 through 70.05.055 to hold the office of local health officer in Washington State in the absence or incapacity of Dr. Rachel Wood or other primary local health officer appointed by the Board of Health for Thurston County.
Second.
It's been moved and seconded as stated. All those in favor say aye.
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 Aye, and that motion carries. Thank you very much, Shelley. The next department item we have is the approved amendment number 1 to the Lewis County contract for the purchase of Nurse Family Partnership Health Services for 2019. And we have Gretchen Toller to give us a little bit of background and maybe some questions and answers, huh?
Hi, thank you, Commissioners, for having me. I'm Gretchen Toller from Thurston County Public Health and Maternal Child Health Nurse Family Partnership Program Manager. I am here to seek approval of the amendment to the Lewis County contract in which we'll extend the NFP services through December of 2019 in Lewis County. The amendment provides for an additional $309,822.25 and allows 2 full-time nurses to continue seeing families down in Lewis County.
Okay. Any questions or comments of Gretchen?
Great program. I'm glad you're doing what you're doing every day for kids. Thank you.
Thank you very much. I
I'm
appreciate
so glad
that.
we can help our neighbor to the south.
Sure.
Very, very glad with that. Yeah, yes, yes.
All righty, so just give an idea how much you're covering in terms of moms and babies in Lewis County with this kind of contract, just generally.
Each nurse carries a caseload of 25, so there's 2 full-time nurses there right now. You know, that's always revolving as people graduate from the program, so typically over a year, I would say between those 2 nurses, they're probably seeing 60 to 65 families. So, and some Some moms, it's their first baby, and other moms, it's maybe baby number 2, baby number 3. So they're assessing and providing interventions around all of the children in the home. So it's probably even more than 65.
Okay, great. Just want to get a number there. All right, is there a motion to approve?
Yep. I move to approve amendment number 1 to the Lewis County contract for the purchase of Nurse Family Partnership 2019 Health Services for the amount of $309,822.25 and authorize the Public Health and Social Services Director to sign the contract.
Second.
It's been moved and seconded as stated. All those in favor say aye.
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 Aye, and that motion carries. Thank you so much, Gretchen.
And I'd like to also just say thank you to Commissioner Blake and all of you for making a difference. I will say, the first time I met Commissioner Blake, I grabbed him in the parking lot at Public Health and Social Services and invited him out on a visit. And he went out and he asked us really hard questions, and I'm grateful for that. I'm glad that somebody's looking at the effectiveness of work, and that meant a lot to me. We luckily do have a lot of data for this program, and we were able to share that. But I really want to thank you. You've made a big difference for the families in this community, and then also our surrounding communities through our partnership. So.
Well, thank you, Gretchen. And I'll just say that I have done a lot of things around this world and helping people and probably finding some bad guys and flushing them out and building some clinics and whatever. But when you stopped me that day, it was one of the life changers for me. Because to be able to help a mom or a child out in the way you and the nurses do, and to get behind that is just phenomenal to see that go through and a child come out ahead of life. And that's so important. And I think the world of you and the leadership you bring, and we'll just keep doing the good stuff we do, right? All right. Thank you, Gretchen.
Thank you very much.
Yeah.
I just need to add something too. If you have this kind of impact on Bud, or even us, I can't imagine what kind of a life-altering experience it is for moms, struggling moms and babies as well.
65 of them in Lewis County, yeah.
And I just want to tell you, by the point, you still have the ear and hearts of the commission.
Yeah.
Thank you.
You tell
very much.
NFP everybody there.
Thank
That's
you.
that's the case.
It means a lot to us. Thank you very much for all that you do for the community and us.
All right.
Thanks,
We'll
Gretchen.
keep going.
Thank you.
Okay, so we did approve that. So this is at number 7, number 8, and number 9. I'm going to kind of move around just for a few minutes for the sake of time, and I'm going to ask if Dr. Wood would like to go ahead and do her report, and then we'll come back to the other two and do the report outs that way.
Thank you for the tech help. So we'll keep it short and sweet, but happy to answer any questions. I am grateful for our community partners who have stepped up to the plate to help us immunize those who do not have housing against hepatitis A. And we couldn't do it without our Medical Reserve Corps, without funding for vaccine from the Housing and Homeless Program, without the Providence Community Care Center and the Olympia Free Clinic. So just wanted to shout that out and say that's going to improve the health for all of us. I also wanted to give you an update. Influenza is just sort of smoldering along, not like spiking yet, but we always are very carefully watching that this time of year and getting weekly updates in terms of, the number of people who present to emergency departments with influenza-like illness and the number of people who get admitted to the hospital with actually a diagnosis of influenza, and the number of tests that are ordered. Number of tests that are ordered are going up. Percent positive is still below 10%. So any questions?
Thank you.
You're welcome.
Ma'am.
My pleasure.
I do. I have a comment to say to you. In the 4 years that I've been here with you, and you've been my doctor, and I love going to you for not only for professional input on the way to build policy and to see the things that you've done in changing the community, whether it be an op-ed or some of the homeless issues. some of the events we've been to. I just thank you so much for being there. And on times of stress, I think you are one of the best to have on staff and to go to. And I really appreciate your professionalism.
Wow.
Yeah, wow.
Well, back at you. Okay, back at you. So, and thank you.
You bet, Doctor. Okay, so having said that, we usually go to, is there anything you want to report out, anything health-wise that you've seen that you want to speak about here?
Well, it
in the
was
public?
hard on my health last week, working for our county manager during the budget process. I guess that's all I'd say. And we spent a fair amount of time on that. So if I gave a activities report related to health, I think that's what it would be. It'd be stressed out over the budget, but we got through it almost. I know later this week we'll finish up. But that and water quality are the two things that I spent most of my week on.
I have nothing for the good of the order.
Nothing good? Okay, so I'm going to turn to the director's report and see what you have to say.
Thank you, Chair Blake. In the interest of time, I'm going to defer my regular director's report to also jump in and say a few words of thanks for your leadership as chair of the Board of Health. When I had the honor and privilege to first meet you, you were newly elected in your role, and it was prior to me being in my role here. And I met you at a local nonprofit, and you came in to ask to volunteer and learn about what was needed in the community. And right away, you made a huge impression on the hearts of so many in this community, because you made it clear that you cared about the health and well-being of this community. You made the health of Thurston County one of your very top priorities in everything that you did. You jumped in and learned, but most importantly, you listened, and you have a very special gift for listening to people who are in need and trying to find ways to make a difference. You have extraordinary leadership, and as the Board of Health, you have encouraged people to come forward and bring any issue that could possibly make a difference in the health of and well-being of everyone. Everyone knows you are very passionate about children and families, and were instrumental in having the vision for the child, family, and community wellness. We all use the term mamas and babies now. Yep. Because of you. Because you made that clear that that was a passion that you had. You quickly became an expert in homelessness and affordable housing. You dove in deep. Again, you listened, you learned, you served alongside all of the people in our community. And I know that for all of the social service providers and other community members that have had the chance to serve with you on Thurston Thrives Coordinating Council, or Housing Action Team, or Hazardous Weather Task Force, or the Blue Team, or the Red Team, or every team.
Silver now. Silver.
Yeah. The Silver Team, yes. You made an incredible difference, and it's going to continue to make a difference. You could teach social determinants of health to just about anybody. You jumped in and you learned that. You have been a passionate for women's issues and domestic violence, equity, behavioral health, poverty. You have been chair of the Behavioral Health Organization. You've served on the Cascade Pacific Action Alliance. I could go on and on about everything that you have done for this community, for this county, for our department, and It's been an absolute honor to have you as chair of the Board of Health and as Thurston County Commissioner for these 4 years. You have had a vision that you told me, and I think many of us very early on, that you wanted Thurston County to be the healthiest county. You want us to be the best, the number one, and we will carry on that vision that you've set forth for us. So thank you very much.
Thank you so much, Shelley. Very kind of you. Okay, I'll try to get to that there. I'll close with a couple comments and then we'll adjourn. Is that all right? Where do I start? So it is not too long ago. Most people know that I'm a military guy, and I almost literally got off the airplane and jumped into this role as a county commissioner. And I wanted to. And while there are Board of County Commissioner issues to deal with, one doesn't know about the Board of Health and how that really has the absolute most direct impact on collectively, individually, in people's lives here in Thurston County. While I wouldn't say I was illiterate about health, I mean, we have it in the military and we look at things and how they are making your workforce grow and your indigenous population grow and be healthy. I didn't realize what it was like here at home. Whew. And so you look at health, it was a whole eye-opener for me, and I love it, and I love it even more. And I really wish I wasn't going because I want to do more. But we have great people around you that help you, and that's from the very beginning. I mean, Don Sloma and Stubner. I got some. We're good. But then here more recently, hit a phenomenal set of talent with Shelley and Liz and Gretchen and Chris and just on and on and on. And Shelley, you are phenomenally, insanely smart and strategically on how to look at health and see where it's at. I mean, I could get you on a whiteboard and say, what about X? And you're thinking X, Y, and Z and far out farther than I can. And that's how I measure myself. Just like, oh my God, she is thinking things through to the nth degree. And I just like, we're going to make a difference in homelessness and housing. Buckle up, here we go. And we have done that in so many ways. And I thank you immensely. And Liz Davis, when it comes to ACEs and the whole social determinants, and working with her and knowing what that means to people out there who have ACEs 1 through 10, which I didn't know, and you can pick your flavor of which one, and there's probably even more, and just how that impacts people's day-to-day lives. So health is in everything, and whether it be ACEs or any aspect of that Thurston Thrives has done, Liz is phenomenal also in terms of but I think strategically she's kind of operationally thinking, because it's not linear, but it's something like just get to the point and we can get on with and figure it out, right? So, and then Gretchen, more tactical in terms of mamas and babies. You're absolutely right. I love mamas and babies. We all three do, but it is something that my grandmother, used to say all the time, there ain't no world if there ain't no woman. And I just always believe in that, and how even if you're a male, you will need to respect and care for the women of Thurston County if I can help it. So that's why I got involved in domestic violence in terms of what Shelley taught me early on and what Safe Place does, and every woman out there. And it's translated into a whole world of being able to make this county work-life place to start with, from breastfeeding to maternal issues that need to make that happen for women out there and become just better in whatever way, a mom, a worker, a person. And I just think that's really the cutting edge of what's always been talked about, but we finally stopped talking about it and finally did it, and I think that's great. The list can go on, and you're right. Mental health, clean water, homeless housing I mentioned, maternal issues. Accreditation is going to be great. Moving from 6th to 7th place in the rankings is probably just a number, but it's not just a number because people start looking at you. You have a reputation now that's greater than what it used to be yesterday or yesteryear. And I think that's what leadership is all about. It's just really getting out there and energizing people, empowering people to do the best they can to make health be the #1 issue every day, whether it's sleep, water, weather, all that comes back to play as far as how you have a great life. And I think that's what I would like to leave Thurston County with, is to live a great life. And thank you, everybody. Thank you to my seatmates in the past and the seatmates currently. You've been very supportive, and even when I've been dogged about certain issues, both for the BOCC and the BoH. But there are still more great things to come, and thank you, everybody. So, yes, sir.
Well, you might wonder where I'm coming from. I see Chris out there in the audience. And Chris, did you ride your bike today? Halfway. Can anybody look out there and see the weather today? And I just use Chris as a comparison. He walks the walk and talks the talk.
He does.
And that's what Colonel Bud Blake has done for these last 4 years. And I find it a bit ironic that he spent his whole military career doing good and trying to do the right thing, helping people. Then you came into this career, and you know, here we should be proud of our country. Here we're having a transfer of power that's not very pleasant, but by golly, where else in the world can this kind of thing take place? You spent your whole career prior to making sure that we could have this transfer of power here, and I want to congratulate you. I wish that you were going, but it didn't turn out the way we thought it would. But we've got good staff, and we're going to work with the new person coming in, and we're going to do good things.
Yep.
And because you set the course, we're going to continue and do good things. Thank you, sir.
Thank you very much. It means a lot coming from you.
You know, and when we were elected, we were kind of painted as three white guys, and we are.
Is that a song?
But like we'd be, it's a country western song. Yeah. We were just, but we have disagreed. We did today.
Yeah.
We've argued. We've argued.
Yeah.
We've gotten along. We've laughed. We have cried together.
Yeah, God.
We've celebrated birthdays, deaths, births, weddings, holidays, birthdays. We've celebrated happy birthday the day after tomorrow, by the way.
Oh, thank you.
The 13th. We have just, this has been a really cool 2 years of a whirlwind, not just get along because there's other similarities.
Because we're three white
This
guys.
is, yeah, because this is setting policy
Yeah.
that's best for the county. And Bud has been a great, as I said earlier, a great mentor on how to set very good policy and look down the road considerably and be strategic about this as well. Don't rush to judgment and do it properly and bring people along, change hearts and minds. And even those small things like bring your infant to work.
Yeah, that's my, I forgot about
It's
that.
a great program, and I'd love to see that expand.
Yeah.
It's a great program.
Love kids, huh?
Oh, yeah. So I thank you too, Mr. Chair, very kindly for all that you've done for the county and for generations to come. You've left a big fingerprint on the on this community and on us.
Thank you so much, sir. Yeah. All right, with that in mind, is there a motion to adjourn?
Mr. Chair, I move to adjourn the Board of Health meeting December 11, 2018.
Second.
It's been moved and seconded to adjourn. All those in favor say aye.
Aye.
Aye, and we are adjourned. Thank you very much, people.
I have one more thing. We have a cake
No.
to thank and
Go ahead and turn the
celebrate
TV
you.
on.
For a slice of